be such like the tuberculous spondylitis. So
Yeah,
this is
bacterial.
one of the form of hematogenous spread tuberculosis. The damage of the spine due to spreading of tuberculosis.
What is it called?
Hematogenic. So there are three types of tuberculosis: primary, secondary, and hematogenic spread. Another name of this is extrapulmonary tuberculosis.
What is this teacher?
Part of lung. Hemorrhagic infarction of the lung. Leaks, so be careful. Don't take them on the part. Brain hemorrhage. Maybe there would be. It's not actually a cyst yet. This is hematoma. The hematoma, yeah. Cyst, it would be the outcome. Yes, if a patient survives such hemorrhagical infarction, their blood masses would be reabsorbed, and only the walls would be rust due to deposition of hemosiderin. But inside there would be a cavity filled with lucid fluid. This is the brain on the stage of organization. It's not a fresh blood, so a few weeks maybe passed, but the cyst would be an outcome.
What are these features?
What else?
This one.
This one. This is the cancer of the stomach. So, the specimen is presented with a part of the stomach, and we can see a formation without clear borders, with ulceration. So you can actually make an accent that maybe this cancer has developed on the border of the ulcer, pre-existed chronic ulcer.
What about this one, teacher?
This is the uterus with multiply fibromyomas. So this is benign tumor of the uterus.
Uterus with
Fibromyoma. This is mixed tumor consisting from both fibrotic tissue and muscle tissue, muscle tissue.
About lipoma, teacher, it can be on the legs. Like,
Lipoma?
Yeah.
Yeah, it can be anywhere where we have
we
a combination
like, take it like surgically, and we after 5 years we have another the same place growing again.
It may relapse, but actually it's not characteristic for benign tumors.
So it will be for malignant.
The type of tumor may be established only on the microscopic investigation. So if you have the description that this tumor had the signs of polymorphism, atypism, so that would be
Malignant.
in most cases malignant types of liposarcoma. But only if you have clinical evidence that it relapsed, it's maybe more than evidence that surgeon didn't remove it within the healthy tissue.
Usually brains, infarction or something.
Kidney during hydronephrosis. So, the microscopic investigation. Chronic pyelonephritis has the appearance of thyroid kidney, but this one is due to obstruction of the ureter by the stone. So this is the outcome of the kidney stone disease. And actually here you should describe the atrophy due to pressure. So the stone obturated the ureter, the urine continued to be produced by the kidney, and this urine began to squeeze the parenchyma of the kidney, and at the last stages of the disease, the kidney has resembled a sac which was chilled by the urine, but it didn't perform any function anymore.
Teacher, what about this one?
This is the intestine during typhoid fever.
Okay. Something else we didn't ask.
Again.
The
Same, yes.
Teacher, what is it, teacher?
Appendicitis.
Appendicitis, yeah?
Yes. Phlegmonous appendicitis.
Phlegmonous appendicitis.
But actually, their type of appendicitis may be also established only during microscopic investigation. So you can just say that the specimen is presented with appendices which has some deposits of membranes on the external surface. It has irregular shape and so on. So we're just describing what you actually see.
Ask guys, yes. Yes, Benjamin, ask. As much as we can. So
This
we
is
can
an example of benign tumor of the skin. So the sample is presented with a part of a skin with round-shaped tumor, which has clear borders with surrounding tissue. It has a cauliflower appearance and so on. So this is just an example of papilloma.
Ask Benjamin.
Septic endocarditis, or bacterial endocarditis, or polypose ulcer. Yes, there are 4 forms of sepsis: septicemia, septicopemia, bacterial endocarditis, and craniosepsis. So this is one of the forms.
For endocarditis, acute warty, relapsing, fibroblastic.
That's for rheumatoid
Yeah, I
endocarditis.
know. How we can differentiate?
Macroscopically,
No.
no how. Only under the microscopic investigation. If there would be some colonies of bacteria, that would be septic endocarditis. If these polyps are presented with thrombotic masses, so that would be warty endocarditis.
Teacher, in MCQ, how we can recognize between relapsing or aborting?
Acute warty will be on the fresh cusps without any signs of sclerosis. And all other forms are secondary. Yes, they would
Maybe
be.
thrombi?
No. Their primary differential diagnostic criteria would be sclerosis of the cusps. If there is overgrowing of connective tissue, then it would be either fibroblastic or either relapsed warty.
It's depending the age of the patient.
Maybe, yes.
Sometimes.
Because the older the patient, the more chances that he had several episodes of endocarditis.
Older patients, relapsing or acute? Yes.
Relapse.
Sure, this one.
This is so-called fibrocavernous tuberculosis of the lung. So the specimen is presented with a part of the lung, and it has a round-shaped cavity with clear borders, which are presented with fibrous capsule. The cavity is connected to the